Good morning, guys. I hope we're all sparkly. The premise behind TRT is normalization of physiology, how your body functions. Testosterone is a fundamental hormone involved in anabolism, growth and repair. Literally loads and loads and loads of processes need testosterone, not just and sexy time. There is a fundamental lack of understanding and awareness within the NHS, disappointingly. I had a guy the other week present. He went to the doctors. He'd had an orchidectomy, so a testicle removed. He'd got low testosterone levels, well, low according to the BSSM guidelines. And he was told by the endocrinologist, you can't have low testosterone, your legs are too hairy. Yeah, no, honest, promise you, absolutely promise you. So these guys who have testicular cancer and a subsequent orchidectomy are often told the other one will pick up the slack. Honest, I promise you, honestly, the other one will pick up the slack. That's why you've got another one. Is it? So, literally absurd. I hear so many horror stories from the NHS. It literally is incredulous. So, feel free to share your NHS horror story. Now, I have a patient who was formerly seen by a very well-known endocrinologist. And he was an ex-steroid user. And he was recommended by this very prominent NHS endocrinologist to go to the internet to source post-cycle therapy, which is HCG, a controlled drug, a Schedule 4 controlled drug, tamoxifen, a selective estrogen receptor modulator, and clomiphene, another SERM. He was told to go to the internet to source these drugs. How utterly disgusting. This endocrinologist refused to help this guy. He's now under my care. And he's incredibly happy. He's well balanced. He's cracking on with life. So the NHS is a sick model. It's not about prevention, it's about cure. And you need to have a disease to be cured. It's not about health optimization. Now, disappointingly, that phrase has been bastardized. It's not about, it's about getting up, feeling motivated, driven, and seizing the day. That's all my guys want. They want a sense of normality. They've lost it. They've often got negative symptoms that they desperately want to reverse. They present to the doctor and they go, your levels aren't quite low enough. What do I have to be? Practically dead before you help me? Well, often or not, yeah. We had a guy with panhypopituitarism. Say that word 5 times really fast. So essentially, his pituitary had been knocked out by a tumour. He literally walked in on death's door. He didn't even get a score in our in-body 770 machine, the bioelectrical impedance scanner that measures all sorts of wonderful parameters and has results comparable to a DEXA scan. His endocrinologist did recommend TRT, but this guy had done his research and said, no, I'm going to go and see the doc. And now he is so much better. He has a girlfriend and he's doing the do. He's very thankful. So it's disappointing, isn't it? That you go to the doctor with negative symptoms and they say, your levels aren't quite low enough. They tend to ignore the British Society for Sexual Medicine guidelines, because it's not a faculty. And they go by the Society for Endocrinology, which goes by the local reference range. Now, the local reference range reflects the current population. And as we all know, the current population is in an optimal state of health, isn't it? We don't suffer from preventable diseases. No, we don't, do we? Oh, we do. Oh, yes. So if there's a 95% confidence interval and you're measuring it on a sick society and you don't take age into consideration, because obviously we know that testosterone levels drop with age, and we're not, obviously exposed to endocrine dysregulators, lots of plastics, cattle being forced to have estrogen to keep milking and then subsequently peeing into the farmland, we're not going to have a problem, are we? So testosterone levels are lowering, reflecting a sick society. So you've got to be really low. And I mean really low. But if you've got hairy legs or you've got a Viking beard, the virilization means that clearly you don't need testosterone replacement therapy. You've had a kid, you don't need testosterone replacement therapy. You've only got one testicle. It's fine. The other one will pick up the slack. Woo! Never go full retard. So, I'm open for a conversation. Are you, Mr. Endocrinologist? Yeah, because lots of guys are needlessly suffering. As I've said in numerous videos before, testosterone plays a pivotal role in mental well-being. Go to the doctor with low mood, here's your antidepressant. Just like that, just like that. You tick the boxes, here's your antidepressant. Is low serotonin the cause of my depression, doc? I don't know. Number one, we don't measure it. It's difficult to measure and quantify, really. But I've been told by the pharmaceutical industry to give you an antidepressant. I need to get you out the door because I've got Mrs. Jones next and she's got a list of 10 problems. Yeah, but when I say I'm low, I'm really low. As in, I have suicidal ideation. Men are not very good at talking. So surely you should take this a little bit more seriously. Men have the highest rate of suicide. I wonder why. You ask for help and you get battered away. We're told to talk, but apparently we offend everybody. So we don't talk. What do? We go to risky behaviours. And then, when you've not got your testosterone replacement therapy because you're not low enough and you've got hairy legs, or you go on the black market, don't you? And you can understand why these guys do it, because they get no help. And then they are injecting whatever. They don't know, but they're resorting to going to underground sources to hopefully feel better. Now, testosterone replacement therapy is complicated. Complicated? Well, you need to carefully titrate the dose according to effect. And as I've said before, you need to work on all aspects of your health. And when you think you've got low testosterone, obviously the only focus that you're going to place is on testosterone replacement therapy, not realizing that you have to have a holistic approach to ongoing health. So these guys, resort to testosterone replacement therapy. They could be injecting anything, absolutely anything. And as we said before, you need careful titration of dose according to effect. Every hormone in excess is excessive. We want to achieve stable male androgen levels for long-term physical and psychological well-being. We want to reverse your negative symptoms. And your physiology is not the same as my physiology. Your requirements are not the same as my requirements. Your genetics are not the same as my genetics. In every other endocrine field, you carefully titrate the dose according to effect. So why is testosterone replacement therapy different? Now, do not jump on TRT prematurely. Testosterone deficiency is a diagnosis of exclusion. So look to address, yes, he says it again, stress reduction, sleep hygiene, nutrition and diet, because you're going to have to do that anyway to feel the benefits of TRT. Do not jump on TRT unnecessarily, but if you do need TRT, seek the advice of a professional who knows his arse from his elbow. And just because he's got DR in front of his name doesn't mean anything. I went and saw a professor, yes, a professor of orthopedics, who told me I needed my meniscus out. I went and saw the medical director of the Premier League, and he injected my knee, and my knee is perfect. So, do your research. Make sure you are comfortable with what you're being told, because your doctor should be acting in your best interest. He should. But the NHS adopts a firefighting model because it's under incredible strain. And disappointingly, there is underdiagnosis and overdiagnosis of testosterone deficiency, and due diligence is not shown. You need 2 confirmed lay readings, and one of those readings, the first reading, should be a comprehensive test. So ideally, look to see if there's anything you could be doing to not need TRT. And the second test is to confirm it. And hopefully say, actually, yeah, you've done well. Continue what you're doing. But if it doesn't go up and chronicity is established, you could be considered for TRT by a proficient clinician. Nobody is too hairy. Well, guys, bit of a rant there. I hope you enjoyed it. And I'll see you on the next one. And guess what I'm going to say next? Earn your reward.